Today, the UK became the first country to approve Pfizer's vaccine. The first batch will start rolling out next week. So what does that mean for the COVID vaccine here in the U.S.?
While the FDA completes its review, the approval of another independent regulatory body should give Americans additional confidence in the quality of such a vaccine. If all goes well, as General Perna will lay out, that means we can make our first shipments of vaccine to states this month, and we are on track to be able to ship enough vaccine for 20 million Americans before the end of the year.
NBC News senior medical correspondent Dr. John Torres joining me now. Dr. John, the UK okaying Pfizer's vaccine first. So what should Americans be watching for here as we await the FDA approval of that same vaccine?
And Allison, what they should be watching for here is what happens at that FDA level and how transparent is that data, because that transparency is going to be extremely important. One of the big issues that we have here in the U.S., it's an issue they have in the U.K. as well, is that vaccine hesitancy, people being concerned that it's happening so fast that the safety might be an issue. But Commissioner Stephen Hahn has told me personally, other experts have said the same thing, that even though they're compressing the time frame, they're not taking any shortcuts on safety. And so you want to see in the meeting that comes up December 10th, which is the Pfizer emergency use authorization meeting with the FDA, and the one that comes up December 17th, which is the Moderna one for the emergency use authorization with the FDA, that the information is out there, it's transparent. It's apparently a lot of information that they're going through right now, that they give that information an understanding of what that means and what they feel, how that information helps them understand the safety behind it. And then once that happens, other groups, independent groups, will be looking at the same information and giving their opinion as well. Once you see that opinion coalesce and all the groups saying, yes, it looks safe and effective, I think at that point, Americans can say, yes, it's time for me to take the vaccine, Allison.
Dr. John, you mentioned that FDA meeting about Pfizer's vaccine next week, December 12th. Commissioner Hahn was back at the White House today. Does the UK approval today change the game here in the U.S. at all, or do you expect the FDA will stick to its schedule, stay the course?
And Allison, it's a yes-no answer to that, because I think, yes, the FDA is going to stick to their same schedule, and I think they're doing that for a very specific reason that I'll get to in a second. But also at the same time, there's more pressure on them right now because the UK, which is our a first world nation, great healthcare, has already approved it, and now they look to approve it here. It's going to be hard for them not to approve it. However, you have to realize there are differences in the two systems. The UK, the reason they approved it so quickly is they typically use data from the manufacturer, but also the manufacturer summarizes that data, interprets it, and gives that information to the regulatory agency, and that's how they look at approval processes. Here in the U.S., it's different. They get the raw data, and that data, it's reams and reams of paperwork that they have to go through. So that's why it takes a couple of weeks. That's why the meetings are scheduled for next week and the week after, so they can go through that data, they can really dig down into it, they can understand what it means, not just for overall populations, but for specific populations based on age and ethnicity. They can really break it down and give us the answers to where it's safest, where it needs to be done the most, and how those vaccines need to be given. And that's the big difference you're going to see, and that's why there's that little bit of delay. So yes, I think there's more pressure on them, but no, I don't think they're going to adjust their schedule at all.
Dr. John, the White House Coronavirus Task Force issued a pretty serious warning to states, saying the COVID risk to all Americans is at a historic high and that we are in a very dangerous place. What are they advising Americans to do as we await a vaccine?
And Allison, they and I can't overemphasize just how dangerous this time period is going to be between now and the end of the new year, because this is essentially the time period where people are going to be traveling, people are going to be getting together, and we're going to see cases rise over the next week or so from the Thanksgiving break. But the hope is that people don't travel, especially if they have pre-existing medical conditions, especially if they're elderly, and people don't travel to see them either, to keep them protected, but also not to spread the coronavirus. So keeping that travel under control is paramount, and that's the information they're giving out there. They're trying to tell people, please stay home. It's one more holiday to get through. We'll get the vaccine there. Hopefully we'll get this pandemic under control by summer, and then you can travel all you want after that, Allison.
Dr. John, the CDC today shortening the recommended quarantine time for people who've been exposed to the coronavirus. They still say that 14-day period's the safest option, but 7 or 10-day periods may work in some cases. What situations are they talking about, and what's their specific advice here?
And Allison, their advice is, yes, that 14 days is still the optimal period to make sure that you don't get or spread coronavirus. But they also realize that not everybody can do that. So compliance has been really low. So they looked at the data and they said, okay, it looks like we could shorten that time period in two different conditions. One, if you develop no symptoms and never get tested, you should quarantine for 10 days. If, on the other hand, you do get tested at day 5 or beyond, and you still end up developing no symptoms, then you can only go to 7 days. You don't have to go all the way to 10. The reason they're doing this is because it looks almost as safe, not completely as safe as the 14 days, but almost as safe, and compliance will be much, much higher. So for the general population, for just about anybody, again, 10 days if you don't get tested, develop no symptoms, 7 days if you get tested at day 5, you're negative, and you never develop symptoms, then you can stop your quarantine if you have those high-risk exposures. And they want to make sure, again, that the key here is that people actually go through that quarantine and end up staying home the time limit they need to, so it doesn't spread, Allison.
Dr. John, a lot of big coronavirus news today. Thank you for walking us through all of it.
You bet.
Hospitals are filling up in Missouri. Officials in St. Louis saying 90% of their ICU beds are full. One hospital even running out of room in its morgue, now using a refrigerated truck to hold bodies. NBC News correspondent Ellison Barber joining us now from DePaul Hospital in Bridgeton, Missouri. It's just outside of St. Louis. Ellison, the St. Louis metro area has more than 900 COVID patients in the hospital right now. How are they managing with limited space?
Yeah, I mean, in this area, about 90% of ICU beds are full as of this afternoon. This hospital has been one of the hospitals hit hardest by the pandemic. They're managing inside as best they can, but you can see this right here. This is a triage tent they have set up outside of the emergency room. It's not in use right now, and they're hoping that they never have to use it. But as the hospitalization rate and the numbers of people needing care for COVID-19, as well as other ailments, goes up in this hospital, they're having to look at options like this to prepare for potentially needing extra space. Just last week inside this hospital on the ICU floor, they were having to double up patients, COVID patients in ICU, put 2 patients, 2 beds in a room because they simply did not have the space. Yesterday, when we were inside the hospital on that ICU floor, they had 2 open beds, but that was not because they had been able to send people home. It was because they'd had so many deaths in the last few days that those beds had now become open. They are at a point here where they say their doctors, their nurses, their healthcare staff, they are beyond exhausted. They have been working very long hours, and on the ICU floor, they are dealing with a lot of death right now, and their concern moving forward is that the system will still be strained, and that not only this hospital will have difficulty caring for people who need help, be it COVID-19 or something else, but the hospitals around the area in St. Louis and the rest of the metropolitan region will struggle as well. Allison?
Ellison, they must be exhausted and so discouraged losing patients like that. I know you spoke with some of the staffers there. What else are they telling you?
Yeah, we talked to doctors and nurses on the COVID ICU floor. And I'll just let you listen to what they had to say because I think they can summarize it better than me. Listen here.
Unfortunately, we're not seeing a lot. Once they get to us, we're not seeing a lot that make it out of here.
How many patients have you lost?
I don't even know our numbers. There's days when it's 3 and 4 a shift. So it's hard.
We've had so many deaths, so many people die that our in-house morgue was full. So we would have patients basically in the room long after they had died, waiting for refrigerated trucks to come so that we could store them somewhere.
We have gone from a stressful work environment to a trauma work environment.
So if you look at the COVID numbers statewide in Missouri, the number of new daily COVID cases has declined recently, and the state overall is currently in what's considered a plateau, which is good news. But hospitalizations, the death rate, that's going up. And then when you look more specifically at St. Louis and the areas right around it, in what they're calling here at least the St. Louis metropolitan region, hospitalizations, death rate, they are so high. They are record-breaking, and they have been record-breaking the last few days. Today, the 7-day average rate for hospitalizations in the St. Louis area, according to the city's regional pandemic task force, is at the highest it has ever been since the pandemic began. Allison?
Wow. Ellison, it's just absolutely heartbreaking. And such an accurate description from that one hospital worker there, saying that it's like being in a trauma situation, but day in and day out and day in and day out. And then they talk about the deaths that they're seeing on just one shift. Tell us more about the mobile morgues and how they're dealing with that.
Yeah, they have an in-house morgue here, so they have a place where they can send people once people have passed. And towards the end of last week, they were just so overwhelmed by the number of deaths, particularly on the ICU floor, that morgue that's on site, it was full, and they had to call for a refrigerated truck so that they could have space to keep the bodies. And that's something that, unfortunately, for this hospital, is not a proactive measure or a precautionary thing. They have that refrigerated truck here, and they are using it right now. Allison.
Oh, Ellison, thank you so much for going and doing these test stories day in and day out. Really important for our viewers to have a clear picture of what's going on out there. Thank you. Ultra cold freezers are now a hot commodity across the country. The incoming Pfizer vaccine requires them for storage. NBC News Now correspondent Dasha Burns got an exclusive look at some of those freezers in Sioux Falls, South Dakota, a rural area that's trying to stay a step ahead in the vaccine distribution process.
So what we're seeing here is just preparation for the COVID vaccine distribution. And the vaccine distribution is complicated just because of the storage requirements and the transportation requirements around the vaccine. So this freezer here that can store the Pfizer vaccine is capable of very ultra cold storage. It actually has an outer door and an inner door. It's on emergency power backup, which means it never loses power. So the hospital has multiple generator backups. We have people on ventilators. We have to make sure we have power all the time. On the side here, you can see a CO2 canister. It also has a CO2 backup. So we have redundancy and backup to make sure that this freezer does not go down. We don't want to waste the vaccine that is in very short supply and hopefully high demand. Yes, so they're actually double doors. So the outer door with the latch on it, you can actually lock this. And then inside here is where the actual shelves for storage are. You can see it's very cold. So this freezer can hold about 75,000 doses of the Pfizer vaccine at minus 80. Obviously, we don't ever expect to have that many doses in the freezer at one time because as soon as we get it in, we'll start turning it over. Yeah, we'll get it out. We'll have it in refrigerators. The Moderna vaccine is a little bit easier to deal with because once you take it out of the freezer, you can actually keep it in the refrigerator for 30 days. Again, the Pfizer, once you take it out of the freezer, it can only be in the refrigerator for 5 days.
Could you show us the Moderna freezer as well? So this is minus 20?
Yep, the minus 20, which we also purchased several of these freezers in August as well. Some of the other complications of the storage are we have these on continuous temperature track monitoring. So they're hooked up to our network and the temperature is logged continuously. And then when we ship and distribute the vaccine to our locations, we have to send data loggers in those coolers, which you see right behind us here, to ensure that we're keeping that vaccine at appropriate temperatures throughout the whole life of the vaccine, right up until it's administered to the patient.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.